Good evening, everyone. Thank you all for joining us for our weekly town hall, Smart Justice during COVID. Um, Tonight, we're joined by my colleague, Dylan Hayre, National Campaign Strategist for the ACLU. Yesterday, the American Civil Liberties Union and the Prison Policy Initiative released a 50-state report entitled Failing Grades, States' Response to COVID-19 in Jails and Prisons. Tonight, we're going to have a discussion about its implications more broadly, and then we're going to talk about the implications here in Wisconsin. But before we dive into that conversation, I just briefly want to talk about some of the conversations I've been having over the last couple of weeks with many of my colleagues and organizer friends around the campaign to defund the police. And one of the things that I try to continue to elevate during these conversations is that when we talk about defund the police, we have to also talk about defund and divest from prisons in our criminal legal system in the same vein. Because we know that it is predatory policing that has contributed to the mass incarceration crisis. So anytime we're talking about defund the police, which is the front end, we also have to talk about defunding and divesting from our prison industrial complex that has harmed individuals as well as communities. At the end of the day, it's all about harm reduction. And the ACLU is going to continue to advance our Smart Justice campaign to reduce harm. We want to get folks out of cages, return individuals to their communities and to their families. And we're hoping that we can continue to work with individuals all over this state who are committed to reducing the footprint of our prison industrial complex here in the state of Wisconsin. And we're also working with our partners here on a local level, the African American Roundtable, Liberate MKE, that is calling for a divestment of $75 million from the police budget and an investment into community, into public health. And so it's on par with the campaign to divest from prisons and invest in people. As my shirt say, people not prison. We want to put an emphasis on people and take the emphasis away from prison and cages. And so with that, I'm going to toss the baton to my colleague, Dylan Hayre, to talk about this report that was released yesterday. And unfortunately, folks, my Wisconsinites, my cheeseheads, my Packer fans, Bucks, Brewers, etc., we received a F+. So Dylan, could you talk a little bit about what this report card is and what are its implications and what folks should know? Yeah.
Sure, happy to, and thank you so much, Sean, and to the whole Wisconsin family for having me on tonight. So as Sean just said, I don't want to bury the lead. Wisconsin did not do well in this 50-state assessment, but no state did well. In fact, every single state scored exceedingly poorly on a scale of 0 to 100, to the point where the highest score was somewhere in the neighborhood of, I think, a 23 or 24 out of 100 or something like that. So we will dive into that report, and I'm happy to kind of answer questions too at the end of my short presentation. But I thought what made sense, just to kind of paint the whole picture here, was to give a little background on sort of what even led to this report, and maybe that helps explain why it's so important and why it fits into the moment that we're in terms of COVID and the need to respond to COVID in our jails and prisons. So let's just start very quickly from the beginning, right? COVID, the pandemic, has been with us now for several months. I know it feels like years, but it has only been several months. And so a lot of this stuff has been very quick and very quickly evolving. But one thing that was unquestionably clear from the beginning was that there was going to be an intersection of crises between mass incarceration and the coronavirus pandemic. And one thing that was clear beyond that was that that intersection of crises would have an enormously disparate impact on Black and Brown communities across the country. Communities that are significantly overrepresented, over-targeted, over-harmed by the criminal legal system to begin with, and communities that, as we are now seeing, are significantly under-resourced and underserved by community investment and healthcare resources. So this was a disaster of epic proportions in the making, and it was a racial justice disaster from the beginning. And the reason that COVID and the criminal legal system kind of so deeply intersect is because of the realities of the criminal legal system, right? So if you are arrested, if you're put in jail, you are forced into close contact with other people. If you are in jail or prison, you are not just cramped in a place with other people, but it is exceedingly unhygienic. Most prisons in this country will not allow you to even have hand sanitizer. Soap costs over a week's worth of wages in most prisons and jails in this country. There's very little access to changes of clothes. You're sleeping within inches of a toilet or a sink or another basin that's shared by other people. These are facilities that are designed to break you and to denigrate you as a human. So it is no surprise that these are also facilities that do not care for or prioritize your health as a human being. Also, beyond the fact that incarcerated people are at enormous risk, staff are at enormous risk in these places. Because even if staff are able to maintain some level of social distancing among themselves or when they get back home to their families, they have to interact with people who are incarcerated. You know, the solution is not just to put everyone in a cage and lock them in there for 24 hours a day, although the Federal Bureau of Prisons and others did try. Staff have to maintain some regular level of contact with the incarcerated population. And so everyone is at risk. You know, public health experts made very clear from the beginning that this was a crisis in prisons and jails. It was going to unfold in a very tragic way. And they advised on what to do. Public health experts said that we need to stop the flow of people coming in, take care of people who are inside jails and prisons, and get as many people out as possible, as quickly as possible. And I emphasize public health experts saying that because despite what you may have heard from some of our naysayers in the world, this was not the ACLU pursuing an agenda when we said get people out. This was not, the liberal social justice movement, as David Brooks wrote in today's New York Times, demanding change. This was people, doctors, people who have spent their lives in the healthcare field saying that you need to get people out of jail and prison right now or people are going to die. And we are seeing that play out. And I should also say that beyond the fact that this affects staff, jails and prisons affect the entire community within which they're located. Jails and prisons are not some isolated, distant, far-off place where if a pandemic gets in there, it can be treated as sort of quarantined in and of itself. There are kind of three big reasons that jails and prisons affect all of us. Number one, jails themselves are vectors of this virus. Staff, like I said, come in and out. Volunteers, corrections officers go in and out every day, and they bring, if there is an infection, they bring the virus with them back home. Additionally, in addition to having staff and volunteers come in and out, the idea that like just having concrete walls around a place, isolates it in a meaningful way is false and has been debunked by medical experts time and again. And thirdly, let's presume that states, it doesn't even have to be a presumption, this is actually the fact, that let's say that most states did not release people as a response to coronavirus, right? Let's just say that states refuse to get people out of jail and prison as a response to coronavirus. Well, coronavirus is going to be here for months, if not longer. And within that time frame, there are going to be people who, by the very nature of their case, are due for release anyway, or who could make bail and would be allowed to leave jail, or whose sentence ends and are going to be released from prison. And so what do? Just not release people anymore? You just stop the churn of the system as much as we need to stop the churn, anyway? No, you can't just decide you're going to hold people indefinitely and forever. So now you're in a position of not having cared for people, not having protected people, but being mandated by law and by the systems in place before this thing began to release people. And who knows what they carry with them and what that looks like, right? So the fact that we're not taking care of people who are incarcerated and the fact that we're not taking care of staff is a major, major issue. And I know there are several kind of arguments to be made against releasing people. Most of them, frankly, rely on the continued dehumanization of incarcerated people, right? The idea that, and this is actually something that was said by a corrections official, and I forget where, but she said, if they broke the law to get in here, what makes you think they can follow the rules when social distancing and all that when they get out? They don't have homes to go to, these inmates and prisoners. Where are they going to get to? The perpetuation of dehumanization of people is a problem in the best of times. It has been deployed as a harmful, tragic excuse for inaction now. And that's completely unjustifiable, inhumane, immoral, and also, again, defies what public health experts have told us. So that's kind of where we've been the last several months, right? And ACLU of Wisconsin, affiliates across the country, the national team has been pushing governors, pushing state actors to take action to respond to all of that. But it was very clear to us several weeks ago that the responses were not forthcoming. They were not as bold or as far-reaching as they needed to be, and they certainly weren't as immediate or as expedient as they needed to be. And so we felt like there was a real need to sort of take stock of where we are and sort of see just sort of what has happened or what has not happened across the country. So we worked with an organization called Prison Policy Initiative. If you don't know them, I recommend that you look them up. They do amazing, amazing work. They have reports all the time on a whole host of criminal justice system issues. And they are widely regarded as a very, very top source and by a lot of people for this type of stuff. So we partnered with them, to do this report, knowing that they have a far greater level of expertise in data analysis. And they also have a history of providing information that has influenced the system and people who work within the system. So when we decided to do this report to assess how states had done in responding to coronavirus in jails and prisons, we decided to look at basically 4 key metrics. And I'll say what they are, then I'll quickly explain kind of why those metrics matter so much. The first is whether or not a jail, or I guess a state prison system, provided testing and personal protective equipment to everyone, incarcerated people and staff in the state facilities. The second metric we looked at was whether or not states had reduced their jail and prison populations in a meaningful way. The third metric we looked at was whether or not the governor or executive agencies like the Department of Correction had issued some level of order or guidance to get people out of jails and prisons. And the fourth metric we looked at was whether or not states are releasing data on testing and releases, and whether or not that data is being disaggregated by race so that we can see the impact that is being had on Black and brown people who are incarcerated. There was also a fifth metric that was at the sort of tacked on to the end of that list that evaluated how many people have died in state prisons across the country. That metric is sort of, I say tacked on not to diminish the severity of people's deaths, obviously. But that data is perhaps some of the hardest data to come by. And we're actually not even really seeing as many deaths as you may expect, because in some places, and a lot of places, the COVID pandemic is just getting started in jails and prisons. This stuff is just getting inside, and we know a lot less than we should because we're not testing, we're not seeing data. And a lot of facilities aren't being transparent with what it is that's happening. And frankly, I think there's historic reason to not trust a facility when they say there have been or have not been deaths inside. We have seen facilities in the past have deaths inside and simply transfer that person to another facility in order to hide that death. So the crisis is probably far worse than we even know it to be. But we felt that it was important to at least center the idea that people are losing their lives regularly as a result of this pandemic. So the metrics, why we chose them, very simply, testing and PPE, again, what public health experts said was the bare minimum you could do to care for people. In fact, it's so bare minimum that the way we designed the scorecard was that if you were providing testing and PPE to some people, like staff who have symptoms or certain parts of the incarcerated population, you get 0 points for that, because you get 0 points for doing the bare minimum. That's not how this works. You don't get credit for doing what you should do at a very basic human level. The way to get points on that was to commit to providing testing and PPE to everyone. And then better yet, here's a bright idea, to actually go ahead and do it. And Wisconsin had made a commitment to testing people. So they did get points for making the commitment to testing everyone. The second metric was whether or not states reduce jail and prison populations. Perhaps more than anything else, public health experts have said that this is key to saving lives of incarcerated people, of staff, and of people in neighboring communities. It was very clear to all of us, anyone who was paying attention, frankly, that nothing would matter as much as reducing the density of prison populations and jail populations. So yes, those metrics are weighted very heavily in this report, as they should be. In fact, we had a news article today where a DOC spokesman from a particular state, not Wisconsin, but a neighboring state, said, this report is ridiculous because it weights too heavily the prison and jail reductions and doesn't factor in what we're actually doing when people are inside. Yes, it weights very heavily prison and jail reductions because that's what you should be doing to save lives. So not sorry about that. The third metric was whether or not governors had issued, or again, executive agencies had issued guidance or orders. This metric's actually really important for sort of a different reason. One of the biggest problems with the criminal legal system, perhaps more than any other system or set of systems in the country, is that it is so decentralized. From state to state, from county to county, even from jail to jail within the same county. There are so many actors and so many decision makers that to think that you could have some uniform response just because you wish for it to be so is ridiculous. The only person in an entire state who can mandate that type of uniformity across a system like this is the governor, or is in some cases the head of Department of Corrections. So unless and until a governor is going to step up and lead and say, here's what we're going to do, here's who's going to be released right now, here's what we're going to do for testing, it's not going to happen. You're just hoping that enough state actors, sort of our local actors, kind of get together and figure it out on their own. And that's a really, really bad way to do it. Spoiler alert here, Wisconsin got 0 points for executive orders or guidance because the governor has not stepped up in a way that he should in this moment, I think, and I'm sure Sean agrees, to sort of, to get this done. And then the final metric, like I said, was data disaggregated by race. Frankly, transparency has always been an issue in jails and prisons. We know so little about what happens inside. One of the reasons it's so crucial for formerly incarcerated people to be leaders in advocacy and policy work is because the stories and experiences they share are not stories and experiences we get to hear, and therefore they are not stories and experiences that guide policy and legislation the way they should. So this was a moment for systems across the country to begin to buck that trend, not just because they should have anyway, but because, again, public health experts have said you need to have a very wide-eyed view of what's happening in your facilities. And you need to let the public know. We have a right to know, because all of our lives, again, are at jeopardy by inaction in jails and prisons. So you need to commit to doing data, and you need to disaggregate the data by race. Disaggregate basically just means breaking it down in a way where you could look very quickly and see how many Black men, how many brown women, whatever you want to call it, are being affected in a certain way. Most places that were releasing data did not do that. So all we really know is the number of people who have been tested, the number of people who have been released. In some places, we can see a breakdown of men versus women, but it's rare. There's only a few states that actually broke it down by race. And given, like I said at the opening of my remarks, the dual nature of the crises impacting Black and brown people every single day, understanding the full picture of how this crisis, COVID-19 in jails and prisons, understanding the full picture of how this crisis affects Black and brown people is supremely important. And so we decided we were gonna highlight that as a must-have. So again, just to go over the Wisconsin score, essentially Wisconsin did commit to testing incarcerated people and staff. They have provided masks from the data we could tell to the population, and they are releasing some data, not just aggregated. And so Wisconsin's score, and then there was a calculation to get the score on that 0 to 100 scale. And Wisconsin's score was a 16.75 out of 100, which is an F+, which is not a good score. And if there are teachers watching, yes, F+ is a made-up grade, but all the states did so poorly that we had to create grades to create some differentiation at the bottom of the scale. It's like having a class of students who are doing so poorly, you have to invent a whole new way to assess them because the assessments we normally use aren't bad enough. One thing I want to point out too, as we look through the data, and it's clear if you read the reports, we did use a lot of system provided data to compile this report. Now, normally that's data that we should be very skeptical of, and we would be very skeptical of, right? We would deeply interrogate the data that DOCs or governor's offices are providing for us. And I'm not saying we don't do that and we won't do that. But there are three really important reasons that we decided to use state-provided data for this report. Number one is just kind of from an analytic perspective, it creates some uniformity across the country. So you know what sources you're looking at, and they're generally the same sources. Even if states collect data differently, they're generally the same sources across the country. Number two is it provides another level of objectivity. Again, it's going to be very hard for people to say that this report is just an ACLU agenda, a prison policy agenda. This is some slanted, skewed bias. Like, we didn't pick up the phone and call Sean and Molly and say, hey, tell us what's going on. We do that every day anyway, but we went straight to the source. We said, tell us what you think you're doing. But then the third reason, which I think is the most important to use state data, is this. We gave states the benefit of the doubt. right? We let states tell their own story in this moment, which is something, again, we normally wouldn't do. But even by your version of the story, you are killing people and you are condemning people to death. And I'll just say that again. I let you tell me a story about what you're doing to save lives. And based on giving your story and you the biggest benefit of the doubt that I could, it is obvious beyond question that you have condemned people to death by your own neglect and unwillingness to take action. That's not good. So, again, as much as we normally want to interrogate that data and ask questions about it, and we will continue to do that, this was an opportunity for us to say, hey, let's see what you did based on what you're telling us. And it still wasn't good enough, not even close. So what's the bottom line on all this? Again, the numbers and grades are, they tell the story. And I think they speak for themselves. But essentially, we saw across the country that the range of responses has been essentially disorganized or ineffective at best to callously non-existent at worst. And if I had to editorialize, I'd say Wisconsin was kind of somewhere in between those two. Largely ineffective, largely disorganized, and largely left up to individual people across the system, across the state, who've taken it upon themselves to try to do some good things here and there. The other thing I'd say, though, is, this report is tragic in a lot of ways. It is heartbreaking. It is infuriating. We acknowledge in the report explicitly at the end that over 500 people have lost their lives. I think over 570 people, over 50 staff have lost their lives. And that's just what we know right now. And so, yeah, you are right to feel hurt and you are right to feel some level of despair. But this pandemic is not over by any stretch. In fact, we're seeing now the 2 worst days in single case numbers in the United States ever. And it is in many ways just starting to affect jails and prisons. So we hope that this report, in addition to offering some real scrutiny, offers some blueprint for what's next. It offers some ideas. Even states that did well can look to other states and say, hey, they did something we didn't. Or, you know what, now that we kind of read through this and think about it, this stuff really isn't that hard for us to do. We should try this. And, even if you're not motivated by getting a better grade from the ACLU and Prison Policy Initiative, which, let's be honest, a lot of people aren't motivated by what the ACLU says, we frame this report to be, again, in line with public health experts' advice and in line with what states are telling us that they were doing. So, for your own sake, for the sake of your population, for the sake of people across the state, even people who, again, aren't incarcerated, you have an obligation to act, and we hope that this report has provided some ideas for how to act and what that action can look like. So I know that's a lot of information I just threw at everyone. I'm happy to pause there, Sean, and just turn it over to Q&A. But again, I just thank you for the work you are doing. I know in Team Wisconsin, this has been a fight like hell for weeks and months. Not like the fight you were having beforehand was easy to begin with, so this has only made things harder. And I know this report isn't sort of a happy moment, but it is a really important moment to reflect. And I hope that at the very least, is what we see people begin to do across the country, particularly as the virus comes back into the news as cases begin to spike. So thank you, Sean. I'm happy to take any questions.
Absolutely. And please, folks who are viewing on Facebook, please feel free to ask questions if you have any. And folks who are also attendees on the Zoom, please feel free to ask questions as well. But I just wanted to say, and of course, many of our teachers who are watching this as well, that a failing grade is not necessarily saying that that's it. A failing grade is you need to improve in this area. And I think that is the way we're looking at this report here at the ACLU. And we've communicated this to our elected officials as well as to the governor's office that we're willing to sit down and talk about possible best next steps. And the reason that we did that is because initially when this pandemic first hit us and the public health experts said that this is what needs to happen to prevent a catastrophe within our correctional and our jail settings, we need to practice social distancing. We need to provide masks. We need to reduce our jail and prison population. We sent a letter to all system actors. We sent a letter to all of the sheriffs. We sent a letter to the governor, as well as elected officials, asking them to begin to implement the recommendations of public health experts who know better than us, lay people. And so, in looking at the grading and methodology that you all use, in order to have received a 100 or a passing grade, we would have to have released a significant amount of people. Ultimately, we will have to release everyone within our carceral setting. Could you talk a little bit about that? About the how possible something like that could have been. Not saying that we shouldn't do that. I mean, that is something that we should do. But could you talk about how folks will say that's not possible?
Sorry. I still don't, you think working remotely for like 3 months, you learn how to use Zoom, but still not happening over here. Yeah, no, Sean, I was saying you caught us, right? Yeah, well, I admit the only way to get a 100 on this scorecard was to release every single person from jail and prison and to do a bunch of other things as well. Is any state going to release every single person from jail and prison in this moment? No, right? We know that's not the case. But that doesn't mean you shouldn't strive for the A, right? And this is not something where if you release just enough people to skate by, you get the A. This is not a moment where A's for effort are an appropriate approach. This is a moment to hold states to the highest standards possible, because the most valuable thing that any one of us has is what's at stake, our life, right? This is not a case. I mean, I just can't emphasize enough. This is not a case of whether or not people in prison are coughing and sneezing. People are dying. They don't come back. You don't get to see your loved ones if they're taken to an infirmary in a jail or prison, and you don't hear from them for 2 weeks. And the next thing you know is they're a corpse, and you never got to figure out what happened, or the fact that they were even symptomatic to begin with. And not to conflate the experience of incarcerated people or corrections officers, but if you're a correction officer and you come home coughing and you have children and you've got to go back to work because the system is so oppressive that even the people who work in it are under the thumb of the system, that to say to your correction officials, I don't want to go to work tomorrow because I don't have a mask or I feel sick, you could lose your job. And a lot of people did. In fact, we heard from a lot of corrections officers that they can't ask for testing because if testing happen, and then they might lose their jobs because of staffing ratios. So yes, to get an A, you had to get everyone out. But that's exactly the standard we wanted to set. You should at least be thinking along those lines in terms of how you respond to a moment like this. People's lives are on the line. But you know what? Short of an A, it's really not that hard to get a pretty good grade on this report card. Think about across the country, and I know this is particularly true in a state like Wisconsin, 45% of people going into prison every single year are going in off of violations of supervision. Most times for things that wouldn't even be a crime were you not on supervision. You miss curfew, you fail to, you miss a phone call, you fail a single drug test or something, and you're thrown into prison for weeks or months or even years. If you just release people who are held on violations of supervision, you can get a pretty good grade. If you release everyone who's over 65, which isn't a massive amount of the population, and frankly, one of the fastest growing prison populations in the country, you get a really good grade. If you release everyone who's within a year of release anyway, which, by the way, you are going to have to do within the next year anyway, if you just get them out now, let them go home, let them return to their families, or let them seek the care and support they need, you would have gotten a pretty good grade. I mean, I didn't do the math sort of like down to the details, but I'm telling you, like a B+ on this thing is not wholly inaccessible. And it just requires a little bit of leadership and a little bit of vision and a little bit of courage. And the fact that states couldn't even get anything above a D-, again, tells you how unwilling they were to act. The metrics we chose, it's a lot of things you have to do, and it's frankly a lot of steps you have to take. But no one would have batted an eye if this report card assessed how well states did in white wealthy communities across the country, right? If we were grading the response of states to COVID-19 in the 50 wealthiest communities in the country, no one would have said anything, right? No one would have said, oh, that's too much. You're asking too much. Or you're demanding too much. But somehow when we talk about the most vulnerable people, Black and brown people, corrections facilities, staff, and incarcerated families, somehow when we talk about those populations, Sean, it becomes, you can't go that far. You can't do too much. You can't take all these steps. Why? It's a choice. You're making a choice. When you make a choice like that, what you're basically saying is some people's lives just count less. And what this report tries to say is no, unacceptable. The things you would have done in the wealthiest communities in the country are things you should have done in jails and prisons from the get-go. And frankly, we're seeing too now, with nursing homes and meatpacking plants, other places that were very, very in the news for being hotspots for coronavirus. Steps were taken to save lives. Good steps, people provided masks and testing in nursing homes, or people allowed to not be at work in meatpacking plants. And it didn't happen enough. And those issues, are continuing to grow as well. I'm not an expert in either of those fields, but I know people, who have said that there are still issues there too. But again, all of this was a choice. None of this had to happen. I think when we started doing this project, we knew that states wouldn't do well, but I honestly don't think we thought it would be like this. I think we thought that, we'd be able to see more and find more, again, particularly looking to states' own versions of the story. So yeah, Sean, I hope that answers the question. It's a really good question. It's a very fair question. It's hard to get 100 on a thing like this, but it's not hard to show some effort. And frankly, we barely even saw that.
Absolutely. And I think that you brought up a good point where you said, if we were talking about white wealthy communities, there would be a different response. But because we're talking about an incarcerated population, which is disproportionately Black and brown,
Mm-hmm.
We don't have that urgent response. And I think that is one of the reasons why we're seeing so much protest on the streets right now, is because folks are demanding that our lives matter, that our lives be taken into consideration, that individuals who take our lives and harm us be held accountable. And I think that we have to also be mindful that when we say Black Lives Matter, we're also talking about the Black and brown lives that resides in our correctional system all over this country. And if folks have read the report card, you will see that almost all 50 states received a F grade, with a few exceptions. A few states received a D. And so that brings me to my next question, and that is basically, with Wisconsin receiving an F plus, which is a made up grade, as you said, how that means that compared to other states, we don't compare to other states. That means that we're that bad that we received a F plus where other states received just simply a F. Could you talk a little bit about, why we received that F plus?
Yeah, sure. Happy to. And I'll just say, I'll just name a few states that scored better than Wisconsin. And this is not to disparage any other states, but I'll name some states that you maybe don't think of as being more proactive than Wisconsin on these issues. So Wisconsin was an F plus at 16.75. Arkansas got 4 points more than Wisconsin. West Virginia got 7 points more than Wisconsin. Oklahoma got about the same score as Wisconsin, like a point less. New Mexico got a point more. Kansas got a point more. Iowa got a point more. I mean, these are states that, again, are typically seen as not being super proactive on these issues. And it's not to say those states did exceedingly well, but it's not hard, right? It's not hard to, again, sort of to think about what needs to happen and to sort of get those things done. As far as why Wisconsin's, did so poorly on this, I think it comes down to a couple things, right? So let's start by giving Wisconsin, credit for where they got the points they did, right? So like I said, there's been a commitment, as far as we could tell, to testing everyone in state facilities. How that testing is going, hard to know, right? I defer to Molly and Sean's expertise on that, but at least there was some public commitment to, we're going to test people. That's good. That's you got points for that. As far as providing masks to people, again, based on what we're hearing from the state, based on the data that we saw that was provided by the state, masks have been provided to people. So that's good, right? That's a good place to start. And the fact that a lot of states didn't provide masks uniformly everywhere says that, that's actually a commendable thing. And we wanted to note that. Again, this is not to punish states. I'll pause and say that too. This is not like a punishment thing, right? I think, Sean, your analogy was so good in terms of like how this would reflect in school if you were a student, right? This is not a F+ go home. This is an F+ come see me in my office after, right? Like, this is something where we want to figure out what to do here. We want to support states. We want to try to find a way to help states sort of make better decisions. So again, credit where it's due. Masks have been provided. But where Wisconsin really struggled, frankly, was in not having executive orders or guidance from the top, not having a uniform response, and also, where Wisconsin got back some points at the end was having some decent jail and prison reduction. So it turns out, based on, again, the data that was available from Vera Institute, from the New York University of Public Health, from organizations that sort of collect this data, Wisconsin actually saw, it looks like about a 16% reduction in jail populations across the state, and like a 5% reduction in prison populations. Now, the good news is that that's pretty good for this report, right? That's in line with some particularly the prison reduction. That's in line with some of the better performing states overall. But think about that, right? You've got a system, again, where half the population in a lot of states is there for technical violations of supervision. You've got a system where, of the 1.3 million people in this country who are incarcerated in state prison, something like 500,000 are there for nonviolent conduct. So even if you accept the false distinction between violence and nonviolence, which I do not, which I know most people do not, but even if you accepted that, that's 500,000 people, right? That's over half the population in state prisons who could be released. And so to say you had a 5% drop in your prison population in the midst of the worst pandemic in our history, the fact that it's extraordinary kind of says how troubling this whole thing is. But to answer your question, Sean, yeah, the points for Wisconsin came from commitment to testing, from providing masks, and from the jail and prison reductions. And where Wisconsin has room to improve is making the data disaggregated by race, making it clear how this is playing out in Black and brown communities and how Black and brown families are being affected. And also having the governor step in and issue an order that gets people out, and issues an order that stops people coming into jail in the first place. There's still room to do it. There's still time to do it. And there's unilateral authority in the governor's office to do it. It's just a matter of getting it done. And to your point, Sean, making the case that this is about saving lives, right? This is not an advocacy moment. That's another thing too. This is not, similar to what I just said, this is not a moment for the ACLU or others to sort of claim a victory in terms of advocacy. This is, I don't care. I'm not telling you to do this stuff so I can get a win. I'm telling you to do this stuff because people are dying. And I know, because public health experts have said, this is what you need to do to stop that from happening. So we'll see. I don't know what the future holds in terms of a second or third assessment, but I know that these are metrics that everyone can keep an eye on. Everyone, and no matter what state you're in, you can kind of jot these down somewhere and just sort of keep an eye on the news, and see what your governor and state actors are doing. And whenever you get a chance to speak with them, ask them if they've done these things and if they're going to take action. Because again, even if you've never been incarcerated in your life is on the line too, if we don't protect people who are incarcerated.
Absolutely. Thank you for that, Dylan.
Of course.
I just want to briefly shout out our coalition partners, Expo and Wisdom, who earlier this week did a drive to decarcerate to Madison, to the State House, to the Capitol. In addition, they drove to the governor's mansion, where they did a direct action asking the governor. Unfortunately, he didn't come out of the mansion, but they asked him if he cared about incarcerated people. And they also asked him to save incarcerated people's lives. And this is something that the ACLU and all the organizations here in the state of Wisconsin is asking the governor, as well as our elected officials, to do, is to save lives, save the lives of these individuals who are within our correctional setting. Because when the judge sentenced them, they didn't sentence them to a death sentence. And they can potentially lose their life if they contract this virus. And so that which leads me to my next question. You've outlined some pretty basic steps. And so the question is, what is the language from the DOC about why not to move forward the basic steps that you've outlined? What are you hearing from DOCs across the country about why they're not moving forward with these basic steps? I know you mentioned early on that a spokesperson said that, the report was was outrageous. Could you talk a little bit about that?
Yeah, no, that's a really good question. The ACLU actually released a letter recently with a large corrections officials union demanding testing and PPE across federal facilities. And we have engaged and spoken with corrections leaders who agree with us on testing and PPE. So it's not every corrections official. I think there are a large number of them who think that testing is necessary, both for the incarcerated people and for the staff there, right? And again, I'll say this again. We should never, ever conflate the experience that incarcerated people have with the experience that correctional staff have. But we should recognize that both of them are working in an oppressive system under oppressive guidelines and rules that create harm. And also, in many cases, both of those groups of people come from the same communities, right? And have suffered the same trauma and heartache in their lives. And so there's a lot of commonality in the experience of sort of being in this system, regardless of what in might mean. But that said, there's definitely been some corrections officers who see the need to do something here. I will say, one thing that we learned is that corrections officers, again, seem to be very reluctant to push for releases because that means, potential job loss, right? If you see prisons that downsize significantly, why do you need 5,000, 10,000 correction officers? I can share an experience from prior to my time at the ACLU when I worked at an organization called Just Leadership USA. We had a campaign called the Close Rikers campaign, where we were trying to close the Rikers Island jails in New York City. And one of the things we talked about is that, this should lead to a drastic, significant reduction in the Department of Corrections workforce. And in many cases, we were calling for a total wipeout of the Department of Corrections. But we also said very clearly that we believe in something called just transitions, right? So people who work as CEOs should be offered an opportunity to work at another city agency at a level salary or something like that, a level pension, right? However you want to frame it. So I don't, for a second, disregard the humanity of people who work in corrections. I don't undercount the fact that they are providing food for their families and a roof over their heads and support for their children or their wives or whoever. I understand that these are jobs and they matter and people need them. But we shouldn't be relying on a system to provide these types of jobs to people. And there's a larger conversation to be had about, shifting corrections jobs to other agencies across the city and across the state and across the country. So that's a different, larger conversation. But that is all a very long way of saying, back to my original point, that it was sad to hear about the fact that they couldn't push for release because it might affect their livelihoods and their paychecks. We heard from people who said we don't want to do testing or things like that because it might incite mass panic. There had been concerns that if you all of a sudden announce that 30% of a population has COVID, then the incarcerated population may panic. I'll just say to all those things, the response is, yeah, they're going to panic. You would too. So why is that a reason to not protect people's lives? Maybe it's just because I come from an advocacy background. Maybe it's because of, I work at the ACLU, so my values are probably pretty obvious to people. But I just cannot for the life of me wrap my head around why you're not saving people's lives. I understand it. Like, let's say COVID is not a thing. Let's say COVID never happened in the world. I am very, very open to having a legitimate policy argument about decarceration or about closing prisons and jails or about downsizing the footprint of the system or about reducing arrests. I have a set of beliefs that I know many people here share. I think my beliefs are founded on the lived experience of people and on research and on what I've observed anecdotally from my own experience as a prosecutor and a litigator and an advocate. So I am firm in my convictions, but I'm open to a conversation, right, where people think we don't need to downsize or we don't need to do this type of a reform or we don't need to go all the way. This isn't about that, right? We're not saying get people out to get people out. We're saying get people out because they're going to die if you don't. We're not saying stop arresting people because you should stop arresting people anyway. Now, certainly there's a much larger policing conversation happening now that's probably long overdue. So, right, we are starting to say that in some different places for some good reasons. But like the point of this was never to say do these things because we want you to or because I as an advocate believe you should. I do want you to, and I do believe you should. But I mean, I know I keep saying it, and it sounds so crass and cliche at this point, but people will die. And when people die, they don't come back. I mean, I don't know. I don't know. I mean, so those were some of the responses we received, right? It was concerns about panic, concerns about job loss, concerns about transparency and what it would mean. And also, you know, I think the other concern we heard from a lot of people was, again, it goes back to that point I made about the dehumanization of people who are incarcerated, right? We can't let these people out. They're thugs, they're criminals, they're monsters, you know, they did a bad thing and this and that. Again, like think about what we're grading you on, right? One of the metrics here is, did you issue an executive order to release people who are medically vulnerable? Like you have some compassion for people who are over 65 and have underlying chronic conditions. So, you know, like can we just have that conversation for a minute? You know, I won't even get into the conversation about violence or nonviolence or what crime actually is. Like we'll talk about that later. You know, another metric here was an executive order mandating the release of people who are within 1 year of release anyway. For God's sakes, they're going home in 365 days. I mean, you can count to 365. You really, you can't like just give them a few months that might save their life. And we've heard stories of people. We've heard stories of families who were weeks away from welcoming their loved one home. And that will never, ever happen now because that person died because of COVID, because you can't get out of an overcrowded bunk in prison or jail. And you can't wash your hands because you can't afford soap. Oh, and by the way, one of the first things to be shut down in prisons and jails was the visitation, was the employment opportunities, as little as they are, was, you know, whatever the open space, the things that actually might have helped mitigate this disaster to some extent. Those are the things that were taken away. There was a real choice made in a lot of places across this country to treat people as nothing more than caged animals and to let them suffer as such, right? And I think that is the story that we're starting to see unfold in a very, very clear way. So yeah, Sean, like I hear it, I get it. There are legitimate conversations and policy arguments we can have for years about what should happen in criminal justice reform. This is not a criminal justice reform conversation. This is a save lives conversation. And we need to get everyone to see there's a real difference between those conversations, a real difference. Yeah, there's a lot of overlap. Yeah, there's some commonality in terms of what we want to see happen. But stop accusing advocates of having an agenda or advancing their goals, because we're not that selfish. But you know what is selfish? To worry about how you're perceived by the public, or how people may think about you if you're releasing people from prison, or what the image may be if you let people out who have been convicted of certain serious things. To be worried about your image in that moment, that's selfish, right? And to put people's lives on the lines because that's what you're worried about, that's selfish. So I know I ranted there, Sean, because you got me with that question.
Yeah, you that was great, man.
I hear it, but I mean, this is saving lives, brother. This is not a reform conversation. This is not a shut it down conversation. This is can we just save a few people's lives, and then a year from now, when this thing is behind us and the country's back up on its feet and we've been able to recover, don't worry, we'll be right back in your legislative halls and in the governor's offices demanding change. We'll be back. We'll have those conversations. But Jesus, can we just stop and save some lives for a minute?
Absolutely. And you're absolutely right. You're absolutely on point. And as you mentioned early on in the discussion, 500 incarcerated individuals lost their lives due to COVID, in addition to 50 correctional staff. These were all preventable deaths. Mm-hmm. And we are not, as you said, just saying shut it down for the sake of shut it down. We're saying release folks to save lives. That's what it all boils down to, is we're trying to save lives. And we're continuing to work tirelessly every day, figuring out a way to get our elected officials to budge and to begin to save lives by passing legislation, by issuing executive orders,
Mhm.
by issuing directives to the correctional staff. And I appreciate, man, everything you just said, because it was point on, and I'm sure it connected to the hearts and minds of our viewers, because everything that you were saying, I was literally holding my hands down but snapping it up, because you're definitely on point, and this is the argument we've been making for the last couple of months since we've been hit with COVID. And I appreciate you, my brother. I appreciate you, spending an hour with us, and shedding a little bit light on the report card that unfortunately we received the F plus in.
You got the plus. I don't know. I mean, maybe.
So maybe we can just say we got a plus
Yeah.
in there. But thank you for joining us tonight. I appreciate you, as I said, and you, every time we call, man, you show up. So we thank you for showing up and speaking your truth, and also shedding light on this report. To our viewers, we're continuing to ask you to sign our petition that we have out, that is asking the governor to stop a prison pandemic, basically to save lives. That is still up on our website. We're continuing to ask folks to sign that petition, to share that petition. And again, we're asking you to ask yourself, if this was one of your loved ones, if this was you, would you want someone to advocate and sign petitions and share petitions on your behalf? We're asking you to do for others what you want others to do for you if you were in this situation. We're also asking folks to continue to share our sheriff toolkit. Sheriffs are elected officials, and there's going to come a time when they are going to campaign for your vote. They're going to ask you to keep them in office or vote them in office for various reasons. And I think that this is a moment where you can hold them accountable by utilizing our sheriff toolkit and asking them to begin to reduce their jail population. In fact, also, Dylan, last night we received a question from a reporter asking, why did Wisconsin lose points for not stopping jail intakes? And our response was the governor, issued an executive order stopping prison intakes, but he did not issue a guidance stopping jail intakes. Mm-hmm. Just real briefly, could you talk about the difference between mm-hmm. That?
Yeah, and I'll just note too that there were a couple places in this report where we noted that states had issued an order stopping prison admission. So very, very quickly, there are two kind of basic facilities in the criminal legal system outside of like immigrant detention facilities, which is sort of a different thing a little bit. There are jails and prisons. When you're arrested, and often before you're even charged or convicted of a crime, you go to jail. Or if you're sentenced to like a very, very short 6 months to a year sentence, you go to jail. Prisons are where people are sent after being convicted of what we would consider, of what people may consider more serious things, right? So typically there's a conflation of the two. People think they're the same. They're very not, and they serve very, very different purposes in the criminal legal system from the system's perspective. So the reason that we did not give points for stopping prison admissions is because what you're basically saying is that I, as the overseer of state prisons, am not going to be responsible for an increase in the population of the facilities I control. But guess where those people stay or go back to? The jails, right? And you're bloating jail populations, and you're putting the onus back on counties and county leaders, right, who then have to figure out, well, people normally leave my jail to go to prison. That's kind of the natural flow of the system. You go from arrest to jail to prison if you're sort of, if you're going that far down the hole in the system. And so when you say to people, you can't have any more people come to prison, they just stay in jail, right? And then you're forcing local actors. So there are places where it made sense and it was a good idea, and we tried to commend that where possible. But really what you're doing is shrugging off the responsibility you have, putting the responsibility back on some local system actors and forcing them to make some hard choices, or putting them in a position where they just have to be responsible for the lives lost. And actually, can I just say one more other quick point, Sean, that's sort of related to that I didn't get to say earlier? One thing I keep hearing, and it goes to your question about arguments against this stuff, not so much from Department of Corrections officials, but from, Twitter trolls, I guess, or from conservatives, is this idea that if you didn't do, if you don't want to be in this position, don't do the crime, that type of thing, right? Or why should we all of a sudden care more because these people made a choice to do a crime and now they're in these facilities? Let me just make this really, really clear from my perspective. And again, my perspective as a former prosecutor. So I've been on this side of the system, right? Crime is definitely a choice, okay? But it's not the choice of the person you're thinking about. Crime is a choice that police make in terms of who they arrest and who they don't, who they confront and who they don't, that prosecutors make in terms of who they convict and who they don't, who they charge and who they don't, that judges make in terms of who they sentence and who they don't, and who they let go and who they don't, that sheriffs make in terms of who gets in or who gets out or who gets released when, that corrections wardens make in terms of who gets access to programming or classes and who doesn't. Those are the choices being made in the system. And for anyone to assume that if you're in one of these facilities, you must have done a thing is so far removed from the truth and the reality of what choice means in this particular system. Spend a day in courts. Don't maybe get the information from Law and Order. Spend a day in court, talk to someone who's been incarcerated, go to the communities that are impacted by this thing, and see for yourself how little of a choice this really is in terms of people's individual actions and the responses they're forced to make in moments of tremendous trauma and survival. So no, people did not make a choice to be in jail and prison. This is not a do the crime, do the time situation. Okay, again, larger conversation. We'll have that a year from now.
Absolutely.
But in the immediate, let's save some lives, get people out, and stop condemning people to death through our neglect and dehumanization, which is exactly what we're doing in this moment.
Yeah, thank you. And so just to wrap up real quick, back to the Sheriff Toolkit. If you want to know who your sheriff is, again, they are elected officials. You can find your sheriff by Googling your county name plus sheriff, and it will take you to a website with contact info. And what you can do is you can use our toolkit, which is a sample letter. And in this letter, we're basically asking the sheriff to reduce the jail population. Again, these are elected officials. You are their constituents, so they should be listening to you, right? So you can use our letter, the sample letter that we have, or you can draft your own letter. We ask that, or we advise or encourage you to, CC your county supervisor, your county executive, to put a little bit more power behind your email, and continue to, hold these elected officials accountable. Continue to ask them to save lives, because that's, at the end of the day, that's what it's all about. It's all about saving lives. It's all about harm reduction. And this is what we're working every day to do, is to save lives. So continue to follow us on all of our social media platforms, on our individual platforms. My colleague Molly Collins, I'm sure, is placing the link for the Sheriff Toolkit in the thread on Facebook, as well as on the Zoom town hall. Next week, join us at 6:30 p.m. Wednesday for another conversation around jail voting. My colleague Raisha Farmer will be facilitating that conversation. So please tune in and join that conversation. Until then, be well, be safe, have a great weekend, and continue to speak for those who can't speak for themselves. Peace. Good night.